I'm in.
I'm in.
I'm in.
We're all in this together.
I'm in. I'm Sergeant Travis Nelson, coordinator of the Maryland State Police COVID Operations Center and liaison with the Maryland Emergency Management Agency. The COVID-19 pandemic has placed us all in challenging situations with uncertain outcomes, and the upcoming vaccine has left us all with many questions. Let's separate fact from myth with information from the Centers for Disease Control and Prevention. Myth: the COVID-19 vaccines were rushed and are unsafe. Fact: the U.S. vaccine safety system ensures that all vaccines are as safe as possible. COVID-19 vaccines were tested in large clinical trials to make sure they meet safety standards. Many people were recruited to participate in these trials to see how the vaccines offer protection to people of different ages, races, ethnicities, as well as those with different medical conditions. Myth: getting COVID-19 is the best way to build immunity. Fact: both this disease and the vaccine are new. We don't know how long protection lasts for those who get infected or those who are vaccinated. What we do know is that COVID-19 has caused very serious illness and death for a lot of people. If you get COVID-19, you also risk giving it to loved ones who may get very sick. Getting a COVID-19 vaccine is a safer choice. Myth: severe side effects are common with the COVID-19 vaccine. Fact: most people do not have serious problems after being vaccinated. However, your arm may be sore, red, or warm to the touch. These symptoms usually go away on their own within a week. Some people report getting a headache or fever when getting the vaccine. These side effects are a sign that your immune system is doing exactly what it is supposed to do to work to build up the protection to the disease. COVID-19 vaccines are being tested in large clinical trials to assess their safety. It will take time and more people getting vaccinated to learn about the very rare or long-term side effects, so safety monitoring will continue. CDC has an independent group of experts that reviews all of the safety data as it comes in and provides regular safety updates. If a safety issue is detected, immediate action will take place to determine if the issue is related to the COVID-19 vaccine and determine the best course of action. Myth: if you have already had COVID-19, there is no need to get vaccinated. Fact: there is not enough information currently available to say if or for how long after infection someone is protected from getting COVID-19 again. This is called natural immunity. Early evidence suggests natural immunity from COVID-19 may not last very long, but more studies are needed before CDC can comment on whether people who had COVID-19 should get a COVID-19 vaccine. Myth: the vaccination can infect you with COVID-19. Fact: none of the COVID-19 vaccines currently in development in the United States use the live virus that causes COVID-19. The vaccine's goal is to teach our immune systems to recognize and fight the virus that causes COVID-19. This process can cause symptoms such as fever, which are normal signs that the body is building immunity. It typically takes a few weeks for the body to build immunity after vaccination. That means it's possible a person could be infected with the virus that causes COVID-19 just before or just after vaccination and get sick. This is because the vaccine has not had enough time to provide protection. Myth: social distancing and mask wearing will stop the pandemic. Fact: stopping a pandemic requires using all the tools available. Vaccines work with your immune system so your body will be ready to fight the virus if you are exposed. Other steps, like covering your nose and mouth with a mask and staying 6 feet away from others, will reduce your chance of being exposed to the virus or spreading it to others. Together, COVID-19 vaccination and following CDC's recommendations to protect yourself and others will offer the best protection from COVID-19. Myth: the vaccine will cause you to test positive on COVID-19 viral tests. Fact: vaccines currently in clinical trials in the United States won't cause you to test positive on viral tests, which are used to see if you have the current infection. If your body develops an immune response, which is the goal of vaccination, there is a possibility you may test positive on some antibody tests. Antibody tests indicate you had a previous infection and that you may have some level of protection against the virus. For more information, visit the Maryland Department of Health or the CDC website. Remember, we're all in this together.
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 We're in this together.
We are all in this together.